done primarily to screen people systematically or randomly for evidence of use of one or more substances with potential for abuse. Drug testing uses a biological sample to detect the presence or absence of a drug or its metabolites. This process can be completed in a variety of settings and with a variety of techniques. Drug testing also play an essential role in the clinical setting because clinical examination, patient self-reporting, and collateral reporting will often underestimate the actual incidence of substance use. The use of drug screen is also becoming increasingly important in management of patients with chronic pain and in treatment of substance use disorders. The most commonly tested for substances are amphetamines, cannabinoids, cocaine, opiates, and PCP.
My name is Nurfatiha, and I will talk about a little bit of theory about chromatography in drug testing. Chromatography is a powerful technique widely used in drug testing for separating, identifying, and quantifying components in a mixture. Chromatography, particularly when it's combined with advanced detection methods like mass spectrometry, it will provide a robust and reliable means of drug testing. It ensuring accurate and comprehensive analysis of complex biological samples. Next, I will explain about basic principles of chromatography. The first one is stationary phase, that is a solid or a liquid spotted on a solid where the sample components are absorbed and separated. The stationary phase can vary based on the type of chromatography, such as paper, silica gel, or a specific column packing material. The second one is mobile phase, which is a liquid or a gas that moves through or over the stationary phase. It will carry the components of the mixture with it. The mobile phase can also vary, such as solvents like water, methanol, acetonitrile, or gases like helium or nitrogen. Next is retention time. This is the time taken as for a particular compound to travel through the stationary phase to the detector. Different compounds have different retention times based on their interactions with the stationary and mobile phases. Lastly is the separation mechanism, which is a compound in chromatography that based on differential partitioning between the mobile and stationary phases. This can be due to various interactions such as adsorption, partition, ion exchange, and also the size exclusion.
Next, I will discuss about methodology of application in drug testing. So, in this application, we use gas chromatography mass spectrometry. Gas chromatography separates volatile and semi-volatile chemicals such as pharmaceuticals in a sample by evaporating it and separating the components according to their affinity for the stationary phase in the column. Following separation, the components are identified using a variety of techniques including flame ionization detection, mass spectrometry, and electron capture detection. Gas chromatography is very effective at detecting low molecular weight substances like cocaine and amphetamines. So this is gas chromatography mass spectrometry machine works. First thing first, we need to do sample preparation. First one is we need to collect 10 ml of urine from the subject. Then centrifuge the urine sample at 3000 rpm for 10 minutes to removing any particle substance. Then transfer 1 ml of supernatant to a clean vial and add 100 microliter of internal standard solution to the urine sample. Add 3 ml of acetonitrile and vortex for 1 minute before centrifuge at 3000 rpm for 10 minutes. To separate, transfer the organic layer to a fresh vial and evaporate it under a nitrogen stream until dry. To silylate the annihilates, combine the residue with 100 microliter of derivatizing agent and heat at 70 Celsius for 30 minutes. The second one, we need to do sample introduction. First, we need to inject 1 microliter of the derivatives sample into the GCMS instrument using an autosampler. The third one, we need to do separation. First, we need to use a capillary column, and the initial temperature must be 70 Celsius and hold for 1 minute. Then for ramp 1, the temperature will increase to 150 Celsius at 20 minutes and hold for 2 minutes. And then helium at a constant flow rate of 1 ml per minute. Next one is detection. To perform a detection, instruments are used to identify and quantify the separated chemicals. Used types include mass spectrometry, which offers molecular weight and structure information, and UV vis detectors, which are used in LC for chemicals that absorb ultraviolet or visible light. Then we need to operate in electron impact mode with a M/Z range of 50 to 550. For data acquisition for target's chemical, use the selected ion monitoring mode to improve the sensitivity and specificity. The next one is analysis. To identify peaks using retention, duration, and mass spectra, any drug and its metabolites should have distinct retention periods and mass spectra. And we need to determine the concentration of each drug and metabolites in the sample using the calibration curve. The last one, confirmation and validation. The method's accuracy, precision, and specificity were ensured by assessing quality control samples with known drug concentration.
Example of the application in drug testing can be used by urine, blood, breath, saliva, sweat, or hair. Urine testing is the most common because it is non-invasive, quick, and able to quantitatively detect a wide range of drugs. The window of detection depends on the frequency and amount of drug intake, but it is about 1 to 4 days for most drugs.
Chromatography is a highly sensitive technique that can detect drugs and their metabolites at very low concentrations, making it an important tool for drug testing. Additionally, chromatography can identify specific drugs and their metabolites. This is essential for forensic analysis and drug testing applications. As we have seen, chromatography is an indispensable technique in the field of drug testing. By separating and identifying compounds within a mixture, it allows for precise detection and quantification of drugs and their metabolites in various biological samples. Techniques like gas chromatography, mass spectrometry, or GCMS serve as the gold standard, providing unmatched sensitivity and specificity. This makes chromatography vital not only for detecting illicit drugs, but also for therapeutic drug monitoring and forensic toxicology. Its ability to deliver accurate and rapid results ensures that drug testing is reliable and effective, safeguarding public health and ensuring proper therapeutic management. Chromatography's versatility and precision make it a cornerstone in modern analytical chemistry, proving its critical role in drug testing applications. Thank you for watching, and I hope this overview has provided you with a clear understanding of how chromatography is applied in drug testing.